Hi guys, in this video I will tell you a little about an article. The name in this article is the sex-related difference, pharmacodynamics and pharmacokinetics difference of frequently prescribed drugs, a review of literature. In this article is quite interesting because it's the cover evidence of the difference, the relation for the male of female sex and the terms the bioavailability, distribution, metabolism, and elimination for the medicines prescribed or used most frequently in the doctor's life, since the sex and the important factor to the metabolism, efficacy, and safety of medicines. Men and women have many differences both anatomical and physiological terms, such as body fat, hormonal regulation, even in the fat physiology and specific organs such as the liver, lungs, and stomach. The Google's architecture, their relevance in the physiology of various diseases such as myocardial infarction or coronary artery disease. Therefore, the way in which drugs act in the different sex is not exact because there are also differences in the metabolism enzymes or but in phase 1 and phase 2 drugs reflectly in how some have less activity in women than and the men or vice versa affect both the efficacy and safety in certain medicines. That is why are exposed to tablets or HFS of metabolism marking which enzymes have greater activity in the man, in the woman, or even that have same level of activity in both sex. It has been discovered that some medicines have greater efficacy in the men than women or vice versa, which is the why where the drugs are only approved for the single sex because in the implications that it turns to the opposite sex such as lack of efficacy or risk of suffering adverse effects. However, it's not the only variable has given direction to these issues, but in the past women weren't considered in the clinical trials of medicines developed, since that has certain complications such as congenital malformation in babies. So these trials focus in the middle-aged men, so that at the beginning there were no difference in the pharmacokinetics and pharmacodynamics of the medications until they began to the notices investigate.